As a preliminary matter, and as required, this is Perry Jewell. I'm the Vice Chairman of the Board of Health. And I'll do a roll call to confirm that all members and persons that we anticipate speaking are present and can hear me. Beginning with the members, please, when I call your name, respond in the affirmative. George Emond, Chairman.
Yes. Yes.
Paul Fortin, Clerk.
Yes.
Evan Waters, Member.
Waters, yes.
And Warren Mayhew, I don't see
No.
a member, but we do have our quorum.
Yes.
So from a staff perspective, we have, of course, Andrea Schnipp, who is our administrative assistant, and Jim Garreffi, who is our agent. And speaking, I believe, for the first item on our agenda tonight, we have Mr. Dan Proctor. Dan, are you here?
I'm here, yes.
Thank you. So, good evening. In accordance with the requirements of the open meeting law, please be advised that this meeting is being recorded and broadcast over the Lunenburg Public Access Channel. And this meeting of the Board of Health is being conducted remotely. The town of Lunenburg, in response to the COVID-19 coronavirus, is currently following the guidance from the Lunenburg Board of Health, the Massachusetts Department of Public Health, and the CDC regarding the virus and steps communities can take to prevent the spread. And all town facilities are currently closed to the public except by appointment. In accordance with the governor's order suspending certain provisions of the open meeting law, General Law, Chapter 30A, Paragraph 20, all meetings are being conducted remotely. The order, which you can find posted on the town website on the COVID-19 Information Center page, accessed through the town manager's webpage, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. And this meeting will allow public comment at the end, limited to 3 minutes per speaker. For this meeting, the Board of Health is convened by a Zoom application as posted on the town's website, identifying how the public may join. Just looking to see if anyone else is there, but I don't see anyone. Accordingly, please be aware that other folks may be able to see you, and take care in screen sharing your computer. Anything that you broadcast will be captured by the recording. So we're now ready really to turn to the first item on the agenda. But before that, I wanted to review some ground rules quickly. The chair will introduce each speaker on the agenda. After they conclude their remarks, the chair will invite the members to provide any comment, questions, or motions. Please remember to mute your phone or computer when you're not speaking. That's to avoid feedback. Please remember to clearly state your name and clearly speak in a way that helps to generate accurate minutes. That should be true for any time you speak, to state your name before speaking. If members wish to engage in any kind of colloquially with other members, please do so through the chair, taking care to identify yourself. Finally, each vote taken in this meeting will be conducted by roll call vote. So, Mr. Chairman, with those comments, the meeting is all yours.
Okay, Perry has finished reading the law to us, so we will proceed with number 1 on our agenda, which is 93 White Street. Dan, are you taking care of this one, I think?
I am. Jack Maloney texted me this afternoon. He had a conflict. He has a meeting in Groton. However, unfortunately, I don't have the ability to bring the plan up on the screen.
That's okay.
But I can explain it pretty simply. 93 White Street. is on the shop corner where Maple Parkway shoots off to the right, but we are on the left-hand side of the road, which is basically some of the better gravel materials. We have 2 minute an inch material, and we are proposing a 5 foot to 4 foot groundwater offset, because that'll allow us to go gravity, and it'll also allow us to keep grading tighter, which will save some fence work that they have on the site. All the properties within that area on White Street are all serviced by town water. So we don't have any wells anywhere, and there are no wetland conservation issues on that site. So the only thing I did notice earlier, when Jack made the request to the Board of Health, he asked from a 4 to a 3 foot groundwater offset, which was a typo, because it's a 5 to a 4. The plan actually clearly shows that we still have a 4 foot groundwater offset. And that's because
I saw that.
that's because of
gonna
the
ask
2
the
minute an inch
question, yeah.
material. Because of the 2 minute an inch, we can't ask for 3 foot.
No, okay. No, I saw that, Dan. I was going to ask that question when you finished, but you beat me to it. So you're going from 5 to 4,
That's correct.
5 feet to 4 feet. Okay, all right.
I certainly can have Jack, fix that first thing tomorrow morning. Get that to
Yeah,
the
I
office.
made a note of it here. We'll get him to correct that for us. Okay, Andrew's sending him an email now as we speak, or a text. Okay, does anybody have any questions or comments, any of the board members? I do not hear any. Is there anybody, I don't know who's out there from the public. I don't have everybody on the screen here. A bunch of names is all.
Mr.
Nothing
Chairman,
there.
I would just ask our agent to give us his comments.
This is such a routine one. Jim, you have anything to say on this one?
First of all, the plan was revised so that they did correct that 5 to 4. So that's all set on the plan that I have, which is dated revised 11/10/2020. So that correction was made on that plan. It is a pretty straightforward upgrade.
Yep.
Again, town water, no wetlands issues. The reduction helps it fit better into the backyard without having fill that'll go across the lot line. So I don't really have any issues with the request.
What was the date, Jim? You said that was corrected?
The plan I'm looking at is 11/10/2020. 11/10.
Okay. 11/10, got it, okay. I made a note of that. Okay, that being all said and done, I have no objections. I don't hear any questions or comments from the other board members. Would someone care to make a motion regarding this request?
Mr. Chairman, I'd be happy to move that we grant the requested variance and local upgrade approval.
Do we have a second, please?
I'll second.
Okay, Paul is seconding this. This is a variance from 310 CMR 154051H, reduction of the required 5 foot offset to 4 feet offset. Motion's made and seconded. All in favor? George Emond, I say aye.
We do a roll call, please?
Yes, I just did. George Emond, aye.
Oh, I'm sorry.
Go ahead, Mark.
Perry Jewell, aye.
Paul Fortin, aye.
Evan Waters, aye.
Okay. We have unanimous vote. The motion passes. Thanks, Dan.
Thank you. Have a good evening.
You too.
Aye, Dan.
Have a good night.
I'm sorry.
Have a good night.
We have to wait a few minutes for the next one. You too.
I guess we have 5 minutes to wait.
Yeah, we got a few minutes to wait. We can go on to some other things. At our last meeting, which was a rather long meeting, we neglected to get to the minutes that we had for the meeting before that. And I would assume everyone at some point in time probably read those minutes. And we would like to move forward. If anybody has any requests, the minutes have been, Perry has read them. I have read them for sure.
I did read them, Mr. Chairman, and even had the benefit of a couple small corrections that you had made that really were more in the form of typos. So
Yes.
I would be happy to move that we accept those October 19th, 2020 minutes.
Okay. Motion has been made to accept the minutes as amended. Is there a second, please?
Yes.
Chairman, I would second that. Evan Waters.
Okay, Evan seconded that. Perry, you made the motion. All in favor? George Emond, aye.
Perry Jewell, aye.
Paul Fortin, aye.
Waters, aye.
Okay, motion is passed unanimously. Our record is intact. We are one with the town clerk's office, so all is good.
I think we might also just point out, Mr. Chairman, that I think Paul took notes of our last meeting,
Yes, he did.
and I don't know if he's forwarded those to Andrea, but he
I
could do so.
don't
And
know that.
I also made some notes on my agenda, so I could help her in pulling some together for our last meeting.
Have we been able to do that, Andrea? No. Not as yet. We've had Perry, if you want to get in touch with her. Paul, if you've got some notes that you had taken, if you could
Yes.
probably email those to Andrea or drop them off at the office or something and have a brief chat with her and she could put something together. This is when Andrea wasn't with us, remember? For the
Great.
thing. Yeah, okay, good.
Yeah, I'll drop them off at the office.
Okay, good.
Thanks.
Okay, that works. Let's see.
Now, we do have someone who's on the phone who I don't really know who it is. Is that Steve Sears? You'll have to unmute.
I don't see
Yes,
it.
it's Steve Sears from David Ross Associates.
Oh,
Okay, good.
Steve, Dave Sears from Ross Associates, yeah. Steve Sears, I'm sorry. Okay, we have a couple of minutes that we have to wait.
What I'll do is I'm going to rename him.
Okay. This is for 81 Maple Parkway.
Yes.
Uh, Yeah,
Wow, that's a thin piece of land.
I said Spears instead of Sears. I'm sorry. Do that again.
Steve, this afternoon, I got a copy of your plan and whoever sent them over, she sent me the whole packet. And I got everything that went to DEP and everything else. Whoever sent them over, tell them they don't have to do that. All we want to see is the stuff relating to the septic system.
Oh, okay, that was probably Pam.
Yeah,
She-
could have been, yeah.
all right.
She figured, what the heck, I'm not sure what he wants, so I'll send it all.
I'll tell her tomorrow.
No, don't say anything to her. You'll just embarrass the poor girl. Just
Oh, okay.
let's let it go. Well, my clock says it's 1:15, so what we have now is we have a request for variances for 81 Maple Parkway. The requests are for 15,405 1H. That's a reduction of offset from estimated high groundwater from 4 feet to 3 feet. And 15,405 1I, a sieve analysis is being performed where perk test cannot be performed. And thirdly, 15,405 1J, reduction of the inlet and outlet tees of the tank and pump from high estimated groundwater. And from the Lunenburg regulations, Section 2, soil absorption system shall not be located less than 100 feet from any wetlands. Steve, how far away is it?
The closest part of the leach field from the wetlands is 51 feet.
51, okay, it's not on the letter, so we want to make sure that we know that. Okay,
Oh, I thought it's, it's on the plan, I see. Yeah, it says SAS, okay.
problem-
It doesn't give the actual measurement, right?
yeah, the problem is that when we get these things, a regular printer, sometimes they come out so small, you can't read all of the numbers.
Oh,
So I
yeah,
didn't see that.
unfortunately, I'm not used to the Zoom meetings. I keep thinking we're gonna be in front of
Yeah.
everybody, so
Yeah.
I apologize for that.
Yeah, it makes it a
All
little
right,
more
let-
difficult.
Let me
But
just,
that's okay. I know
You
what
want
it
me
is. That's all we needed. Thank you.
want me to explain what's going on here the best I can?
Yes, I would.
Okay, can you hear me all right?
Yeah,
Okay. Again, this is a very skinny, narrow lot. It's 100 feet wide, goes back about 300 feet, but from about the middle of the lot all the way back is wetlands. And actually, there's a wetlands, bordering vegetative wetlands that runs right along the property line, the whole length from the back of the house past where the system's going. So we're kind of confined here with this one. This is why it's, unfortunately, the groundwater is so high. We had high groundwater in all three holes. It was so high, we had to send the soil out for the sieve analysis. That's one of the variances we're asking for.
mhm,
And then try to save some cost on the small little wall on the left-hand side to catch the fill and grading from the property line. We've reduced it from a 4-foot groundwater offset to the 3-foot, try to help out the folks that live here. And the inlet and the outlets of the tank and the pump chamber are within that this 12-inch separation of groundwater because the plumbing goes underneath the basement. There's basement facilities here, so the tank and the pump chamber have to be set so low in the ground that to accommodate the plumbing. That's that final variance. And again, your variance of 100 feet from wetlands, there's no way possible that we can meet that. So we've tried to do the best we can here. If you can kind of visualize the plan and go for that. We filed with the conservation, but I have not yet heard back from Matt yet on a date to review it. But and that's about it. Again, there's no increase in flow or anything. It's just straightforward fixing system that's here.
yep, okay. Any board members have any questions or comments?
Yes, I would like to ask Steve, I can see that there's wetlands on the right-hand side of the plan. I'm viewing it as a PDF, so I can zoom in and see anything I want. On the left-hand side, are all of the, is there someone's property on the left-hand side of the plan?
Yes, there's a house right to the left of this property. So, and his grading is basically right up to the property line too. So there's no wetlands on that side, on the left-hand side. It's just a lawn and an existing house.
And is he being fed by town water as well?
Yes, he is.
Okay, thank you.
Yep. Okay.
Anyone else? Jim, you have comments, please?
Sure. So again, Maple Parkway is kind of a tough road to work on because of the high water table and because of the poorly drained soils. So, and with a narrow lot, it makes it a lot more difficult to get the grading to work and keep it all on the lot. Additionally, here you have some wetlands, and again, just trying to balance, trying to figure out what's the best set of variances to ask for. I had talked to Stevie about possibly lowering the system a foot, which this plan represents, so that we could try to get the grading to fit a little better, reduce the height and length of that wall, because you've got town water, and because the way the system's going over the contours, it may be just 3 feet to water on the high end of the system, but as it goes across the contours, you're going to easily meet the 4-foot offset. So I figured it was a good compromise to try to get that wall and grading down. So I don't have any issue with that because, again, it's also meeting the wetlands offset in Title V,
Right.
and it's got town water.
Right, okay. Anything else? Okay, we can entertain a motion on this one. Somebody?
I'll make a motion to accept the variance of 4 to 3 feet. That's what it is, right?
Well, there's three variances.
Right, but that's, I'm sorry I didn't get the other ones. I'll retract that and have someone that remembers what they all are, motion, please. Sorry.
The variance is a reduction of our system offset from 4 feet to 3 feet. A sieve analysis was performed because the soil was wet. And reduction in the inlet and outlet keys of the tank pump. That's fairly common when you need to control the pitch from the plumbing in the house to the tank outside, and it's not always easily accomplishable without this variance. And one from the Lunenburg regulations, which is the soil absorption system shall be less than 100 feet from the wetlands. Title V calls for 50 feet. Ours has been 100 feet as long as I've been on the board. And I think the intent of it was just to be able to have a look at that to see if there's, and especially around the lakes with these smaller lots, if there's any alternatives to that. The 51 feet does meet Title V.
So I'll make a motion to accept those variances.
Okay. Motion's made. Is there a second?
Chairman, this is Evan Waters. I would second that motion.
Okay. Evan seconds it. All in favor? George Emond, please votes aye.
Perry Jewell, aye.
Paul Fortin, aye.
Evan Waters, aye.
Okay, motion's made and seconded and passed unanimously. The variances are granted.
Okay, thank you very much for your time.
Thank you.
Thank you.
Okay, have a good night.
You too.
Thank you. All right.
It's my kind of meeting. Okay, there's, see what else we got on the, wait a minute, where's my agenda? Yeah, Jim, you want to talk a little bit about COVID?
Not really, but I will.
By the way, Andrew, did you send that letter from Jim out to the board members? Okay, everybody got that letter that Jim wrote. I left off the names and sent it to Heather, so it'll show up somewhere in the on the town website for our watching public, as it were. I thought it was an excellent piece of work. I learned something from it, and I hope the rest of you did too. Usually when I send these little notes off, I try to put little notes about what Jim has told me during the week, or where I picked up from the news or whatever. It's helpful when someone that you know off the street comes up and asks you a question, you're able to speak relatively intelligently about this, which isn't always easy. Did anybody have a chance to read some of that stuff?
Yes.
Not yet. Okay. Be sure to read it. There's some good stuff in there.
Very good. I read through.
Good. Thank you.
Mr. Chairman, Perry Jewell, rather.
Yeah, good. Excellent. Excellent. Jim, speak to us.
Sure.
Impart us with wisdom.
I don't know about that, but I'll try. So since our last meeting, which was the day before the governor made the announcements on those 3 revised or new orders,
Yes.
those orders went into effect on the 6th of November. And the big changes, the face covering, again, we're seeing crazy numbers of cases in the state. We're seeing more cases in the district, in the Neshoba district, than we saw in the spring. I mean, lots more than we saw in the spring. So something's happening out there, and people ask me, what is it? And what I'm saying is that, there's more cases around. There are more people coming into contact with people, and we're doing more of it indoors. So to me, that's kind of a summary of why we're seeing this stuff.
Yeah.
Now, I think the governor's orders or the revised orders are trying to address those things. So in the first one for face covering, two important changes that he made to the original order that went back to May. One is he took out the language about whenever you can't maintain 6 feet of distancing. So essentially that exemption used to be that if I was walking on the street and I was more than 6 feet apart or in a public location and more than 6 feet from other people, I didn't have to wear a mask. And generally speaking, I think that's acceptable, except that we're not in kind of general times anymore. And I don't know if we need to get the message out there more strongly. But what he did add into that was that you needed to wear them in public locations. And DPH is further kind of defined for us that public location is any place the public can go. So parking lot, the streets, the roadways, sidewalks. You know, if you're in an office building, the public part of the office building, people would need to wear masks. If it's an office, the rest of the people in the office need to follow the sector-specific workplace standards the state's put in place. So if you had your own private office, you wouldn't necessarily need to wear a mask. But if you came out to the reception area to meet somebody, you would. So that's how that kind of gets interpreted. One of the things with the new face covering order, I think I'm not sure how enforceable on public ways it will be. There's not enough of me and the police department to monitor all the streets in Lunenburg to make sure that every time somebody's walking or biking or whatever. So the way we're kind of handling it is carry a mask with you. If you're walking by yourself on the street, you're really not endangering anyone, but have it with you in case you find yourself in a situation where there are others so that you can put it on. I don't know how else to enforce that except that way there. So I'm certainly open to suggestions. We will address any mask complaints within a facility, and we do that on a regular basis. But that one on the public, if a group is going to a public park, I don't know, it's a sports team on the fields, those are all governed, like sports teams are governed by a separate set of standards that require masks. If you're a landscaping company, you should be wearing masks. If you're doing construction, so it's governed in different ways. But generally speaking, if you're in an area where the public can go, you need to have a mask on. The second order was to try to limit gatherings. Again, through the contact tracing that's being done, they're finding that transmission is occurring through these gatherings, whether they're large family gatherings, whether they're gatherings that the high school kids are having, whether they're gatherings that are at college. So what they're trying to do is limit those number of people who can gather. And particularly now as we're going indoors, they really would like to limit the number of people. And so this order now talks about limiting the number of people in a private residence to 10. Again, I'm not quite sure how we're going to enforce that, but again, it's one of these things where this is where we're seeing the increase. This is where we're seeing the cases. And I'll talk about the cases a little bit after this. So I think the governor is trying to get across to people. It's like, you really need to limit the number of people that you're having in a gathering. In the outdoors, again, it's at a private residence, 25, I think. And then I think it's 100 in a public place if you're a low risk town. And Lunenburg's still a low risk town. The last one is talking about closing establishments that serve alcohol by 9:30. So essentially restaurants are the only ones who should be able to be serving alcohol because bars aren't allowed until phase 4, which won't be until we have a widely available vaccine. And so they need to be serving food that they prepare on site. And I'll talk a little bit about that afterwards. And they need to have served the last, again, DEP has clarified that if you're in a restaurant seated and receive your food at 9:30, that's okay. You've got until 10 o'clock when they need to close to finish the meal and drink, but they can't be serving anybody. So if you come in at 9:30 and sit down, they can't serve. You need to be seated and be served by 9:30. Again, how enforceable this is, I don't know. I've talked to the police chief about a few establishments in town that they went in on Halloween, and there were people with drinks in front of them, but not food in front of them. So I'm going to put together something that includes this educational materials, that includes this new gathering order. The reduced hours orders, and go around to the facilities to remind them of the fact that you can only serve food, you can only serve drinks with your food, and they have to be seated. Food has to be prepared on site. One of the establishments, there were a number of cases, so that place is closed for at least a couple of weeks while they kind of figure out what's happening, and we make sure they're meeting all the food service establishments. But I want to get some educational information to the rest of the facilities to let them know. So again, if there's any questions on that piece of it.
Jim, Perry, Jewell.
Sure.
Yeah, just I've been to several restaurants and most of them seem to, like allow you to order a drink at the same time that you were ordering your food. So
Sure.
you very well could be sitting there drinking your drink before your food arrives.
Sure.
And then
I think in the case of the ones with the police departments, that wasn't the case.
I'm sure.
But you're
But-
right. It's
But
you're
that,
right. So it's a judgment call. I mean, I've over the summer, I've been to places where people have had their food, they had their drink first because I went in to talk to them, and I'm assuming that they're getting their food after. So,
but
again,
even if they, order it concurrently, which
Yeah.
many of them do ask you to do,
sure. No.
you still get your drink first. And then
Nope.
similarly, you might be done and they take the food away, the plates away, but you still could be finishing your beer or whatever.
Sure. And again, I'm not going to be there to know what the sequence is,
Yeah.
but what we're seeing is, last week, and I'll talk about the cases a little bit now. Last week, you saw, somewhere between 45 and 50 cases in Lunenburg. Crazy number of new cases.
Yeah.
It wasn't that bad the week before, and this week's not shaping up to be this bad. I mean, I only have the first 3 days of this kind of week so far, and the numbers aren't nearly as high. But some things we noticed with the cases, we're seeing multiple cases at the same address. So that's telling me you're getting some in-house transmission, which is normal. I mean, we've seen situations if a parent gets it, likely the kids may get it. If a kid has it, the siblings may get it. So that kind of stuff's not surprising. But I told George about this. We had a meeting. There's a Fitchburg health director called a meeting last week, the beginning of last week, because of the church and the number of cases they were seeing with the church. We're seeing some of that in Lunenburg. But when the contact tracing collaborative, who's doing a lot of this contact tracing now, was on the call, they were also stating that they had a small cluster at one of the establishments in Lunenburg. So we're seeing transmission potentially in some of these places where people are having drinking food. And it's easy to see that if you're sitting at a table, because the restaurant rule allows up to 10 people to sit at a table. So if you had 10 people sitting at a table who are having that drink and one of them's asymptomatic, it's a good chance that you're getting more than just your drinking food that night at the table. And that's some of the concern we have. So I'm not quite sure how we're going to do the enforcement on that, but the establishment needs to know that, if they're not, making every chance to do that, and let's say the police department goes in there and there's no food to be found, they're going to forward over a report to us. And I would recommend to you, if we're seeing that in a wide, to start enforcement with the states, escalating enforcement, because this is one of the reasons bars aren't open is people stand together a lot, stand close, socialize. I'm not saying any of these things are bad. I'm just saying these are things that seem to be driving case numbers. And again, with the case numbers being as high, we really want to try to kind of nip this so that we can reduce those case numbers. So that's one piece of it I think we need to try to address. When I say we, I need to kind of put some educational material together and go out to those facilities and just remind them of the concern we have, the case numbers we have, and the information that we got from the contact tracing collaborative. Fitchburg was concerned enough that last week the health director was talking about some drastic things like maybe rolling back the step that they're in, just so they can get a handle on the number of cases. The mayors would like some input from DPH before they do that. So there'll be a subsequent meeting, and George knows, so we'll be at that meeting just because we're kind of touching the town borders there. So the concern is there. I mean, right now, the number of cases in all of the towns really are outstripping our ability to do the contact tracing in-house. So we are sending a lot of cases to the contact tracing collaborative, and we're focusing on the school-age children for the most part, because they have so many tentacles in the community. Plus, we really want to keep an eye on the school and what's happening in the school to try to catch that quickly. So I don't know if anyone has any questions about the case numbers and the concerns.
Guess not.
Well, like I say, I don't know what caused the spurt all of a sudden, but like I say, the weeks leading up to it, the cases were building like they were building throughout the state. But what happened in that week, I just don't know.
Well, all of our members, Jim, as I said, I sent along that letter you wrote to me And so they've all read it. And hopefully, as they're out and about, they can spread the word. They've got a little bit more ammunition now where they can discuss this a little bit more intelligently, perhaps. And I don't know, maybe it'll work, maybe it won't. You don't know. People are people.
That's right. And that's why I kind of put that together, because we were hearing, we had in one case, not in Lunenburg, but a school teacher who wasn't feeling well on a Monday. On a Tuesday, she went and got a test, but still was in school. Thursday, she got the results. Now she's in school 4 days. She's positive.
Yep.
It's like, what part of don't come to work sick don't you get?
Yeah.
We wanted to get the message out about, if there's a reason that you go get tested, you should stay home till you get those results. Maybe it's negative. Maybe you got to take a day off or so. But if you're positive, you've just generated more close contacts and more people staying home to be quarantined. So they're just, I don't know. You can keep repeating these distancing and the face coverings, but what people don't realize is you don't really know who's standing in front of you, where they've been, who they've been with, whether they've traveled. You just don't know. And so you need to protect yourself from that other person, not because you're afraid of the person, but just because if you get too close and they don't know they're sick, you put yourself at risk. And again, we're trying to keep people from putting themselves at risk.
Try to keep them healthy. Not easy.
I have a-
Back
Mr. Chairman?
in the old days, you had folks who would go to work sick. If they didn't feel well, they'd go to work sick just because they would go to work sick. That was what you did. And they were proud of it. And their bosses were happy to see them every day. It's a different world now. If you're sick, stay home. Evan, I'm sorry. I think I interrupted you.
Mr. Chairman, I had a question. It's Perry Jewell. I was just going to, I guess, comment that on the numbers game. I find it personally kind of, confusing to get the two numbers for Lunenburg regularly. And I know we can't control that totally, but I find there's much more, I have more personal credibility in your number, where you have names associated with it, than I do the kind of one that we're getting from the state that we really don't know what's associated with it. But at the same time, I find that, we're working with the total from March, I guess. And I think that also kind of clouds, this sort of trend you've just talked about, where we had a big upsurge last week, and if someone very carefully is not following, what was the number last week, what's the number this week, so on, they may miss that. And to me, that's, what's really critical, I guess, in my mind, is those that are perhaps still contagious, let's say, and I don't know what that number is, whether it's 2 weeks or 3 weeks or pick a number. But, somehow the idea that we're going all the way back to March, to me, kind of clouds the issue. You could do very well and drag the number way down, and yet the totals would still be perhaps, troublesome. Good night. So I don't know exactly what the answer on that is. I guess what I'm saying is that maybe a little bit more attention or focus on
What do you say?
the near term versus the total for all time might be more useful. Or maybe you have to do both. I don't know.
So in that state report, if I may, Perry, they do list one of the columns. So there's a state report that we get those numbers from, and I'll explain why the state number is more accurate than the one I'm providing. Because what the state has done is they've adjusted. Occasionally we'll get a report for somebody who's not living in town. So the state eventually catches up with that and changes the number. So the numbers are a little different because there are cases like that. So the number that the state's providing is the number that's been corrected, if you will. I just lost my train of thought. Oh, and the larger state report, they put a line for each community. And what they do is they'll list the number of cases in the 2-week period that they provide in that report. So whether that would be more helpful to have, just so you could compare 2 weeks to 2 weeks in addition to the totals. I don't know if you're trying to put some more context to it. So, because
personally, I think that would be helpful. And I don't know exactly what the town manager uses or how she uses it, or or the selectmen, but I would think both numbers. Certainly, the 2-week number to me is the most relevant in the sense that that kind of best communicates what the risk is in the community.
Well, that still takes into account, Perry, it takes into account the previous ones too. They just changed the way they calculate the metric. So I think that Perry's driving at, and I tend to agree with him. We've got numbers that go all the way back into March, which are still factored into this weekly number that we're getting based on 100,000 people at a population level, which we don't have. And then they fudge that down based on whether it's 10 a week or 15 a week or 20 a week or whatever it is. I would be interested in knowing how many new cases I had this week. You can give me the other number too, but I'd like to know how many we had this week. And then I'd like to know a separate number, how many we have next week and the week after that. So I can look back and say, okay, we had 10, then we had 12, then we had 15. I could see it going up. Well, now we're back down to 10. I think it's a little easier to recognize mentally. It's something a little bit easier to grab onto rather than thinking about 100,000 and this crazy metric they're doing, and did they get this one out or that one out? I think, is that more or less what you're looking at, Barry? Something a bit simpler? You didn't hear me.
Barry? Did you hear him?
You're muted, Barry.
I'm sorry, George, were you talking to me?
Yeah, that's okay.
Oh, no, I agree with what you said. I think that would be useful.
It gives you a little bit of a better handle what happened last week versus this week versus next week. And when you take this metric, you've always got in the back of your mind that you've got all these other factors that they're putting in there. And to myself, sometimes look at it and say, well, what does this really mean? What does this number really mean?
Mr.
Yeah,
Chairman,
we've
would you,
159 since last March. How many have we had since last week? That's when we don't know that number.
Mr. Chairman, would you
We know the
actually,
number, but the state doesn't tell us what that number is.
if you would be interested, Mr. Chairman, I actually plot it because that's what I do. Just like
You spent money on
I
COVID?
have spreadsheets going all over the place with this stuff that has
Oh, yeah.
rolling averages. You've got percent changes on a boxcar average and whatnot. It does show, you can see when you have the trending up at that point, when you actually have the percent difference on a 14-day average, that's where you kind of get a grasp for the rise that you're really looking at, as opposed to just kind of that continuous add. I'd be happy to share it if you want, just to kind of put it out there. I update it every.
Oh, sure. You can send it off to me. I know Andrea would like to have a copy of it too.
Sure. Yeah, I can switch it over to a Google Doc to make it a little more
If
live.
you want to do the work, I'll certainly read.
Oh, I've been doing it since March.
Right, and I'll stop doing the math.
Or that's fine with me.
Boy, am I glad you're on the board.
Amen.
Okay, anybody else have anything to talk about?
Chairman, I actually have a question.
Wait a minute. Kevin?
Jim, I'm not sure if you're aware, but there is a town meeting tomorrow at
Yes.
middle school, high school. I know that they've gone to great lengths to make sure it's as safe as possible, but given the fact that we're in the middle of, at least as of last week, quite a spike, is there extra precautions that should be taking place? Is there anything that can be sort of, I mean, if we're talking restaurants as potential super spreader or spreading events and house gatherings and whatnot, we're now going to pack lots of people into an auditorium.
Sure. So a couple of things. I know when they did the town meeting in the springtime, they were able to distance everyone 6 feet, and they required masks. Because town meeting is a legislative body, the order doesn't really, they're exempt from the order because they're a legislative body. One of the concerns, George had sent me some information over the weekend about having a different room for people who didn't wear masks. And I qualified that with the town manager. And there is an exemption for people who have medical or some other disability that keeps them from wearing a mask. And those are really the only people who should not be wearing masks. And having a separate room for them kind of protects other people in the room. So I think a big emphasis on making sure people are 6 feet apart and a big emphasis on making sure everybody has their mask on would be kind of the protocols you want to follow for that meeting.
Jim, did we get that resolved?
I've had some conversation with Heather about that back and forth. Just, she understood that there were exemptions, and that's really the only people who should be doing it is the people who had exemptions.
Right, okay. Because
Total
originally,
number, the total number has to be less than 100, correct?
No, so the town meeting, so legislative bodies aren't, that doesn't apply to them. So your selectmen's meeting, it would, your meeting, it would, but the legislative body, which is town meeting in the town, it doesn't apply to that.
That's kind of odd.
isn't it?
Well, yes, but legislative bodies often make rules that don't apply to them. Congress, the state house. And
Point
again,
well
there's a
taken.
part that government needs to continue on, so that's why the legislative body may get that exemption.
They can still wear masks.
So again, for people at town meeting, shouldn't go there if you're sick. I don't care how dedicated you are to your community. Definitely go there with your mask on, and definitely make sure the distancing is in place.
Yeah.
We talk about the difference between that and a restaurant or a bar. Chances are there's probably one person speaking, or maybe the board up front at town meeting. The rest of the people should have masks on at that point in time. It's not like you're sitting across from 9 other people having a conversation much closer than 6 feet. So it would be nice if you could do it outside, but it's getting a little chilly for that these days. But again, those public health protocols should be followed firmly because of the number of cases in town.
Thank
Anybody
you very
else?
much. I'm just curious.
No, that's.
Nothing else, anyone? Okay, I'll entertain a motion. Do we adjourn and go home?
I'll second that.
Somebody's gonna make the motion first.
Oh, I thought you did.
No?
Sorry.
Okay, I'll make a motion. to adjourn.
Perry Jewell, I'll move that we adjourn.
Okay, I'll second it. How's that? Motion's made and seconded. All in favor? Aye. George Emond.
Perry Jewell, aye.
Paul Fortin, aye.
Evan Waters, aye.
Aye. Thank you, gentlemen. We're adjourned.
Thank you, everyone.
Very much. Have a
Thank
good
you
night.
all for
Thank you.
coming
Good
tonight.
night.
It's a good meeting.
Very good.
Very good.